Hello again, massage therapists of IMC and beyond. It's Jason Kraft coming at you again with a little policy review / comments on the massage industry, policies, procedures, etc. I am coming across more and more facilities, spas, etc., which are promoting rules against pregnant women getting massages. I don't know where this thought process is coming from, except possibly a fear of liability, which, hey, no problem. That is up to each individual therapist and each massage facility to make that call on their own. I have not, however, been presented with significant information by any of these individuals or locations as to new case studies, new research showing that pregnant women should not receive massage for any significant reason, physiologically speaking. Here at IMC in the Massage College, we do have policies about pregnant ladies in our massage clinic. We accept pregnant ladies at any week, first, second, or third trimester. There are concerns that do relate to those that have to be qualified, and so we're going to go through some of those real quick. And then based on this, of course, obviously, first off, IMC, we accept pregnant ladies for massages at our student clinic. Clarify that real fast. But as an educational video for where you may work in your future as students or where you may work as therapists in the working industry, let's go through a few quick things. First off, I'm going to reference a quick book we have. Clay and Pound's Clinical Basic Massage Therapy. At the end of Chapter 2, it does talk about special populations, including pregnant ladies. And it does mention that there are specific reasons why a pregnant lady should not be worked on until she has gained specific permissions from her attending physician, from her OB-GYN or her general practitioner. And one of those is for any reason if she's considered a high-risk pregnancy, then she should definitely not be receiving massage without that doctor's permission, and maybe not at all. They define high-risk pregnancy as if the woman has used fertility methods to get pregnant. If she had a hard time getting pregnant to begin with, then it's not a good idea. If she has miscarried in the first trimester of previous pregnancies. The first trimester is the most delicate time of the entire pregnancy because the embryo is so small, it is still highly prone to damage by excess toxins, which may be released into the bloodstream by a person getting really intensive deep tissue work, and or if the mother has not has a lot of toxicity build up before she gets pregnant, she's not gotten massage on a regular basis or had other physical activity like exercise, and suddenly decides after a long lifestyle of not very healthy that now I'm going to get in good shape now that I'm pregnant. Well, getting a lot of sudden circulation can release some of those toxins and damage the the embryo, different stages. That's a different lecture. In that delicate first trimester. So it's not they can't get in the first trimester, but the toxicity level is a potential concern in certain scenarios like that. If the woman has cardiac or pulmonary, heart or lung conditions, again, she should check with her doctor first. If the woman's been diagnosed with uncontrolled asthma, autoimmune diseases, diabetes, epilepsy, HIV/AIDS, kidney diseases, or thyroid diseases, or diseases, she should check with her physician first. If the woman has any history of problems in previous pregnancies, if she's had a hard time in the past, she should check with her physician about the current situation. If the woman is carrying multiples, twins, triplets, octuplets, more than one baby inside, increases the chances of complications. Check with physician. If the woman is under age 17, the body might not be fully matured, physically ready to carry, and more delicate, over age 35. More potential through a lifetime for damage to the body, damage to the DNA of the egg, thus embryo, etc., etc. Those put her in a high-risk situation, and they need specific medical permissions. Here at IMC, we do have a couple more things we look for, specifically if they've been diagnosed high risk pregnancy, as mentioned there, if they've had preterm labor or miscarriages in the past, if they've been told they're preeclamptic. This typically is shown by uncontrolled swelling. It can indicate a level of high blood pressure, which can create a life-threatening situation for child and mother. They definitely need to check with any severe swelling that don't know what's causing it. They need to check with their doctor before they get worked here. Now, if their doctor clears them, says there's no problem, then we can really, really help that with even just light Swedish. But certainly more advanced students who have taken lymph drainage classes can help that even more. So boom, boom, after doctor. Pregnancy-induced hypertension, so hypertension or diabetes connected to the pregnancy, gestational diabetes. Nausea, vomiting, lightheadedness. Hey, you feel like puking? How about a massage? No, this should be an obvious thing here. Vaginal bleeding or discharge. Again, this should be obvious, but it has to be listed. Decrease in fetal movement over the 24 hours. Or say something like, oh, well, I fell yesterday, and there hasn't been much motion the last couple days. I'm a little concerned. I'm going to go check it out after my massage. No, you should check it out before your massage. Current state of pregnancy, more important than relaxing massage. Go get that taken care of, then come back and enjoy a relaxing massage once you know things are well. Diarrhea, which obviously makes for an uncomfortable state in the massage anyway, but also increases risk of dehydration, which creates potential problems. Abdominal pain, which could indicate a series of potential problems. Excessive swelling of arms and legs, which again could lead to preeclampsia, eclampsia, be life-threatening. Pitting edema. Notice when I press on my skin, when I let go, it bounces right back. If there was still a dent there when I let go, that's a sign of pitting edema, which need to see a doctor right away, could indicate that high blood pressure, that preeclampsia, eclampsia. General ideas on pregnancy massage. The biggest concern is client comfort. A lot of pregnant women are still very comfortable for the first couple months laying face down, and they really want to. And they're comfortable laying on their back, because, really, we're talking embryo is like smaller than a eraser size on a pencil. So we're not really talking about any compression issues or anything. And as long as the woman's comfortable, most places will allow them to lay face up and face down. Here at IMC, when we find out a woman's pregnant, we go straight to sideline position. We don't have tables that sit up. That would also be a viable solution if we had those at our facility, if you have them at your facility. Here at our facility, we've chosen to go straight to sideline to maximize safety. But technically, throughout the first trimester, as long as the woman's comfortable, her body's kind of the guide to that's probably still okay. Most books still approve that. Going to the sideline position is the position that is the most comfortable throughout the entire pregnancy. Putting pillows under the leg, under the arm to maintain the proper alignment of the spine and the pelvis. We'll do a video on that later. We teach that during our classes. Doing the sitting up position, kind of a reclining position, like you're relaxing on the couch, is also good, as long as the woman doesn't slump down so low and start to cave in so that the uterus is laying on the back. As long as the back is sloped and the uterus is still over the pelvis, then that is still perfectly safe and pretty comfortable for the woman as well. Journal comment, the first trimester is the most dangerous. Because of the toxin levels. Also, it tends to be very uncomfortable for a lot of women as they're prone to nausea, morning sickness. Second trimester tends to be the most comfortable for the pregnant woman. The morning sickness is usually passed for most women. They haven't gotten typically larger and experienced a lot of the swelling and stuff typically as much. Third trimester is really the safest for the baby, but also creates additional discomfort for the woman and positioning difficulties. But as far as positioning, by the end of the first trimester, you should be moving into the reclining or the sideline position. Even if the woman's comfort is key, but that usually is where most books and texts and references say, move to these other positions to maximize safety and to avoid any compression of the uterus. Some people are just not that aware of their body. And I don't want to take that risk on for me as a therapist or for my facility I work in. I'm suggesting you probably don't too. Alrighty, hey, just this little commentary, because I'm seeing these questions come up a lot in the industry, seeing a lot of conflicting information, people saying, oh, we do it this way, so that must be the right way. There are different ways. But go back to research. Some things are hardlined, and then everything else, you kind of go with where you're willing to draw the line with liability and with the woman's comfort and providing good customer service. Hey, coming to you, producing good informational videos about the massage industry. Stick with us. Indiana Massage College.